Doctor, my sister is COVID positive and she is having symptoms like high grade fever and cough, loss of smell. She is unable to taste any sweet dish like that. So, what treatment according to you she should start taking?
If your sister has all these symptoms and if she has tested positive for COVID, then I would just like to tell that during this first phase of COVID, that patients generally have high grade fever and it can extend from around 5 to 12 days. This phase of high grade fever and symptoms like body pains, myalgias, like we say, and also other symptoms like you said, loss of taste and loss of smell. So need not worry much. You need to constantly monitor her. She needs to constantly check out, be watchful for any new development of symptoms, and in the time being she just needs to depending upon her temperature, what temperature she is having, so she needs to take paracetamol tablet just to cut down her fever. And also if the fever is like high grade fever, like it is going more than 100, then she can try doing sponging, cold sponging. That also helps in basically lowering down the temperature. Many people do ask us whether there is any role of starting antibiotics like azithromycin, which is being given very frequently.
Doxycycline also sometimes.
Yes, and doxycycline also, which is very frequently being given these days to all the COVID patients. I would strongly recommend not to go for these medications unless and until there is a suspicion of some underlying bacterial infection also along with these viral symptoms. So how do we know whether there is a bacterial infection? So there are a few things like if we get a baseline testing done, and if your the WBC counts, if the total leukocyte counts are raised, or if you are having a cough with expectoration and there is any change in the color of expectoration, like if the sputum is some greenish yellowish tinge in color, so there can be chances or possibility that there is even super added or combined, there is a bacterial infection also going on. So in that conditions, yes, there is role of giving antibiotics, and I guess that should be decided again by the physician, not by the patient himself or herself. So otherwise, like normal viral fever, we just need to cut down the temperature. We need to basically give paracetamol, antipyretic drugs which relieve the temperature. And also if many people do ask like whether they should be taking any prophylactic medications, like even if they are not having any symptoms.
Yeah, like my uncle, he went for the testing, although he was not having any symptoms, and his COVID report is positive, but still he is not having any fever or body ache or like that. So he is asking whether he should start any medication or not, or some people are recommending to start on vitamin C, vitamin D, and other multivitamins like that, or ivermectin. So according to you, what is your opinion? Should he start on these medications or not?
Well, yeah, right question. So, if you are you have tested positive, but you are not having any symptoms, so we call that as asymptomatic COVID positive. In such patients, we just need to monitor and be watchful for any development of any kind of symptoms. And such patients do not have to take any medicines at all. They just have to maintain their hydration. They have to drink loads of fluids, keep themselves isolated, be in safe hands, and need to monitor. They need not take any kind of medicines. As far as the role of vitamins is concerned, so basically there is no harm in taking vitamins. Like you can take vitamins. There is there are people who have been recommending vitamin C, vitamin D, and
Especially the zinc.
and yes, even minerals like zinc. So all these things can be taken by the patient, but there is no definite role in the management or the treatment as far as the treatment of COVID is concerned. So they can help. They can in fact basically it is just like a placebo effect. Like if you have these vitamins and you have these medicines, so that basically motivates and keeps your moral boosted. So there is nothing that you need to worry about until unless you have symptoms. So only if you have symptoms, then you go for medication, or you take a consultation from your physician that whether you should start on any drugs or not.
But if someone comes in contact with a COVID positive person and his report is still negative, is there any way to prevent the development of infection, or is there any way to prevent like the test will not come positive in the future? Should he start some medication to prevent him from the development of COVID positive report or the COVID positive symptoms?
See, there is no role of any prophylactic medication. Again, I would just keep on highlighting this point, that there is no need of taking any medications in advance, because like any other viral fever, like dengue fever or any other viral common flu that we have, there is no prophylactic medication which can be given for this infection. We don't know when and how the patient can contract COVID from any person. So we need not recommend, neither should we propagate this thing to any of our family members or our friends that they should start taking prophylactic medications, because nowadays I have heard and seen people just hoarding on all the medicines, keeping it inside their houses, and they start having these medications. This is a wrong thing that any person is practicing, because overall, if we see in the long run, by chance such people later on develop COVID symptoms. So when we actually require these drugs and medications to be given, maybe those people will become resistant to these medications, and then those medications will not affect the person as they should. So we should not give any prophylactic medication. All such patients should just wisely isolate them, maintain all the hygienic conditions, do proper hand hygiene, maintain proper sanitization, use the face mask, keep themselves isolated, and avoid any kind of further contact. And that is how they can stay safe and then can just keep themselves prevented from COVID.
And is it like the more stress we will have, there are more chances of deterioration?
Yes, definitely. Any condition, any medical condition, if you take more stress, if you just keep thinking negative, become pessimistic, and you lose all hopes, then that just brings down, not only it brings down the moral of the patient, but it also hampers the moral of your treating physician. Because if you constantly keep giving them negative outputs that you are not improving, and you are having an impending doom that you might not just come out of this process, so even the physician who is trying to treat you, even that physician goes under a lot of stress. So the most important message that should be conveyed to the patient and to his family members and the caregivers, that do not panic. Yes, definitely it is a very fatal disease, and many people around you might have heard many news and through social media that many people are experiencing great trouble because of this disease and succumbing to the disease. But you need not worry. You just need to be very closely, you need to observe yourself, observe your family members, and just take proper precautions, take care of your disease. And if at all there is certain severe condition or any deterioration in your symptoms, then you need hospitalization depending upon the consultation which you make with your physician.